Is metformin a magic medication? We've known about metformin since the 1920s, but it was only in 1957 that it was introduced as a medication in France. It was almost 40 years later that metformin was approved by the FDA for use in the United States. Today, metformin is first line therapy for type 2 diabetes, and it is one of the most frequently prescribed medications in the world. Increasingly, metformin is used on and off label for numerous illnesses. Metformin reduces both fasting blood sugars and blood sugars after eating. In addition, it rarely causes low blood sugars that can threaten life. Many patients were delighted to find that metformin was weight neutral, preventing weight gain. Many other treatments for diabetes cause patients to gain weight. Patients who take metformin may have less chance of getting some types of cancer. These include breast cancer, endometrial cancer, and colon cancer. But further studies are needed to establish a causal relationship. Some studies show that metformin may reduce the risk of cardiovascular disease in patients with diabetes. The American Diabetes Association recommends metformin to prevent diabetes in patients with prediabetes. Doctors use metformin off label to treat high male hormones in women with polycystic ovarian syndrome. It is now being investigated for its benefits in patients with HIV related metabolic disorders. And metformin is being studied for its use in patients with COVID-19 infections. It was found to have a potent effect on certain immune cells and anti-inflammatory properties. Amazingly, metformin was found to increase the lifespan in laboratory animals, and it may do so in humans as well. Metformin works by decreasing glucose production in the liver, and it also reduces the absorption of glucose from the bowel. In the muscles, metformin increases the sensitivity to insulin. At the same time, it increases hormone levels in the bowel that increase the secretion of insulin. But the drug may also change the makeup of the bacteria in our bowels, known as the microbiota. In fact, this may be one of the primary ways it lowers our blood sugar. Metformin causes more bacteria that produce short-chain fatty acids to grow in our bowel. These stimulate the production of substances in our bowel known as incretins, and these stimulate the release of insulin. Metformin appears to be an inexpensive and amazing medication. But there's one caveat. You should avoid taking metformin if you have kidney failure. This can lead to a condition known as lactic acidosis. I hope you found this information useful. If you did, like and share with friends and family. Support this channel by subscribing. Until the next video, stay healthy and stay safe.